Today we're going to talk about the first 48 hours in the nursing home. If you're coming from a hospital, they may or may not send some medication to help you get by the first couple of days at the nursing home. If they don't, what happens is the nursing home enters all of your medication into their system. Then they order it through their pharmacy, and when it gets delivered, it gets put into their treatment cart, and then it gets dispersed to you on the appropriate schedule. Depending when you go to the nursing home and when all of those meds are entered into the system, it could take up to 48 hours to get your medication figured out. So you need to be patient, and you need to ask the nurses what the status of all your meds are. Are they all in? And see if you're getting them all within the first 48 hours. This is going to add a little anxiety. So it's helpful if the resident has somebody familiar with them who can help talk to the nursing staff and make sure everything is figured out correctly. The next thing that's going to happen is the doctor is likely going to stop by and introduce himself. This is the doctor who's responsible for your general care. So instead of going out to a general physician, you'll now have a doctor through the nursing home. You don't have to worry about remembering this guy's name or face. You'll probably see him again, and if you don't, the nurses will remember who he is. So it's just a meet or greet, so you know that he exists. Often what will happen is instead of talking directly with the doctor, you'll end up working with a physician's assistant who will then facilitate your care through the doctor. So this is just a meet and greet, and you want to say hello. But if you have any questions or concerns about your care, you can bring them up with the doctor then. And always, if you want to see the doctor, just tell your nurse that you want to see the doctor and what the problem is, and the nurse will facilitate it. Okay? The next thing that will likely happen is the dietitian will come in, and they'll ask you what your likes and your dislikes are. There's probably a printed menu for every day. It probably rotates by week, and you can see what you like and you dislike. My suggestion would be to not offer any likes or dislikes unless you have some kind of allergy or a hard dislike. Otherwise, get every menu option, taste it, make note of the ones you don't like, and then tell them what your likes and your dislikes are. You can always add to that menu in your kitchen changes when you want. Again, just tell a nurse or an STNA that you want to update your likes and your dislikes. The next thing that will happen is the nurse or the STNA will come in and ask you what your bathing schedule would be like. Do you like to take baths in the morning or the evening? Do you want to take a bed bath, a shower? And some facilities even have a bathtub that you can use. It depends on the facility. They schedule this all out, not just for you, but everybody has a bath schedule. So you need to think ahead what your schedule is going to be like and when you would like to take a bath. Of course, if you're going out or you have an accident or something like that, you can always take a bath when you need it. Lastly, you're going to want to pay attention to the routine that happens in the nursing home. You'll notice that in the morning, when they serve breakfast, the nurses and the STNAs are usually busy. The nurse is passing meds, and the STNAs are passing lunch or breakfast, whatever the meal is. These are high traffic times in the hallways, and people are busy doing things. Unless you have a real emergency, when you put your call light on during these times, it may take a little extra time to get it answered. So pay attention to the schedule. When they're delivering breakfast, when they're delivering lunch, when they're delivering dinner, and learn the routine. The sooner that the residents get adjusted to the routine, the better it is for everybody. The first 48 hours can really be stressful for a resident, so I highly suggest that they have a friendly face with them a couple of hours every day so they can stay calm and feel like there's somebody on their side. I hope you like this video, and if you do, click the like button below and the subscribe button so you get an update notification on all of my videos. Thank you.